Clayton. I'm a physical therapist assistant student, and I need you to verify your name and your date of birth.
Ann Corver, and my date of birth is 1/2/91.
Okay. As my job, I'm responsible to help you reach your goals that you've set with your physical therapist. But to do those things for you, I need to get consent from you to treat you.
Yeah.
Is that okay?
Mm-hmm.
Okay. So as we get started, I need to get a mental picture of where you're at today, how you're feeling. I need to know if you're in pain and where it's at, and what level your pain is at.
Okay, so I'm feeling a little bit of pain in like my back and then a little bit in my knee.
Okay.
I would say, I don't know, it just hurts, I don't know.
What, on a scale of 1 to 10, 1 being the,
probably
like the
like a
least.
3 or a 4.
3 or 4, so not terrible, but it's there.
Mm-hmm.
Okay. So what types of activities cause these problems for you in your back?
When I'm like bending over, like picking things up, or like, I don't know, when I'm doing some, like playing sports and stuff, it aggravates it, so.
Okay. So does the pain ever migrate? Does it go from different parts of your back? Does it go up or down? It's just in the lower back?
Yeah, mostly just stays right there.
Okay.
There.
So there's a technique that I'm going to show you of how to pick things up off the floor, because we do it all the time. It's repetitive, and sometimes those repetitive movements causes injuries, even though we do them all the time. It just wears the muscles out. So the move that I'm going to show you is the golfer's pick.
Okay.
Now, the golfer's pick, it requires some balance, and so if you're not really have really good balance, you're going to need something to stabilize one side of your body while you do it.
Okay.
Okay? So the idea behind the golfer's pick is you obviously have something on the ground and you need to pick it up. Okay? So what you would do is you would place one hand on something stable, and with that same leg being your stable leg, then you're going to keep your torso to your shoulders straight. You want to keep that back straight, and you want to lift that leg and reach at the same time. And at that time, your chest is going to be parallel to the floor as you pick it up. Okay? So as you try this, keeping your back straight requires some good posture. But to do that, you have to keep your pelvis straight.
Okay.
So there's some bones on the front of your pelvis that you can probably feel because they stick out. Okay, that's the front of your spine, and there's some bones on the back that you can feel in the very back, and that's the rear of your spine. So if you push your spine forward and tilt your pelvis forward, that's an anterior tilt.
Okay.
And if you rotate backwards and scrunch your stomach muscles, then that's a posterior tilt. We want to find that spot that's right in the middle.
Okay.
Make sure that everything's loose in your hips and there's no tension on your back or your stomach. Okay? So, can you repeat to me what we're going to be doing?
Okay, so I'm going to be practicing lifting up an object. If I'm not very good at balance, I hold on to a steady object, and I bend down and pick it up and lift one leg up, and then stand up and then put it down the same way.
Okay. Do you want to try it?
Sure, yeah. Okay, so like this, right? Then.
Okay, that's good. Now what happens if that object is out in the middle of the floor and there's nothing for you to stabilize yourself and don't have very good balance? What are you going to do about that?
Find maybe an object that I can bring to steady myself.
Okay, so let's say maybe a chair.
Okay, so use that.
Use the arm of the chair, the back of the chair.
Okay.
So that's a couple of different ways. So like if you're at work and something falls off of your desk, and how do most of us pick up things when we're at work? We're sitting at a desk or something on the floor.
Bend over.
We just bend over, right? We rotate the trunk. We do all kinds of bad things. So we should stand up, maybe turn our chair around, get stable, and then pick up our object. And I think that'll help your back pain.
Okay, awesome.
Is there anything you need to ask me, any questions that you have about this?
I think I'm good.
Okay.
Thank you.
Well,